to Living Dayton. Thanks so much for joining us today. You know, it's one of the most common types of pregnancy loss, and when it becomes a recurring problem, it can leave devastating effects. But luckily, there is some hope. Dr. Jeremy Groll joins me now to discuss recurrent miscarriages. Great to have you on the show today.
Thanks, Katie.
You know, this is a tough topic.
Yes,
when people suffer from something like this, it is such a loss. But there is some hope, and that's what you want to talk about today.
Yes, there is. And it is devastating when people find out they're pregnant, and of course they're already planning their family and have visions, and it all comes crashing to a halt.
Yeah.
And when it happens over and over, that they feel like, is this ever going to work?
Yeah.
But when you look at the chances of miscarriage, that over the course, about 15% of pregnancies don't make it through the first trimester, unfortunately.
Okay.
So it is very common. And most of these have nothing to do with the mom or dad.
Okay.
That they are spontaneous things with that particular egg, and it just, you know, is not going to be a viable pregnancy. But if we've had a series of them after 3 miscarriages, it does mean there's a higher chance of a miscarriage again,
Okay.
and which is up to about 35%. But if we flip that coin, that means that's about a 65 to 70% chance that with their next pregnancy, if we don't do anything, that they're going to actually carry successfully.
After the 3rd, you said.
So if they've had a history of 3 miscarriages, that the chances on their next attempt is going to be about 65%. So, but with that higher risk, there are a lot of potential factors that can contribute to it. So that's where we look as far as the medical evaluation. And one of the most common things is trouble with the uterus, and then a structural defect. And it could be something very common like fibroids or polyps, or we may find some things that people are born with, like a uterine septum. And these are things that could actually be amenable to a very simple surgical correction, outpatient surgery, and can greatly improve their chance for a successful pregnancy.
And of course, we have some things up on your screen there: genetic defects, couples' medical conditions of, you know, the couple conceiving, and then chromosomal abnormalities with the embryo as well.
Yes, and so that, as I mentioned, the chromosomes are going to be the most common problem, in that about half of all miscarriages are going to be due to an imbalance of the chromosomes. Most of them happen spontaneously, and it's just a, you know, fluke sort of event. But there's about 5% of people who may carry a genetic imbalance, and that one of the chromosomes is kind of stuck to another. It's something what we call a translocation. And so there we can identify this and potentially provide additional options, whether it's genetic testing on the embryos through something like IVF, or if we look into other approaches like either egg or sperm donation. So there's ways that we can, you know, provide options. And when we look as far as the other medical conditions, that many things like trouble with their sugar metabolism, and we've talked about this before,
For sure.
that will hinder the, you know, implantation process, and maybe as much as a 40% chance in people who have, you know, significant abnormalities there. So.
Yeah. Dr. Groll, it's great information. You know, it's shedding some light. There is light at the end of the tunnel if you have had recurring miscarriages. We can come see you there in Centerville, SpringCreekFertility.com too, if we have more questions, right?
That's right.
Thank you so much for being here.
Great. Thanks,
Dr.
Kate.
Jeremy Groll, keeping us informed here live on Living Dayton. Don't go away. We'll be right back.